Hey, good and happy Friday to you. Glad to have you with us. It is a sunshiny Friday morning. Hey, Bill, you're not quite in the frame yet. Here we go. Look, there he is. Come on in. Put that coffee down. You grab a cup of coffee of your own, and let's have some coffee talk here.
That was the beauty shot.
That was
showing Lance's beautiful cafe.
I thought you were going to come through the other way and show us your beautiful boutte.
Now you got to pay for that.
Which, by the way,
I've learned not to give that away.
Use that word "beautiful" in a euphemistic sense.
There is a charge for that, and I will do nudity, by the way. But there's a charge.
Friday morning, here we are, La Divina Italian Cafe at Acadian and Perkins, and we invite you to come on by and grab a cup with us, get some damn delicious breakfast and pastries. And you know the thing I like to remind people of every once in a while about La Divina, it's one of the few places where you can get real Italian gelato, and that's a good thing to do with the kids. You know, your kids are bored.
Oh, I thought you meant turn them into gelato.
No.
Pain in the ass
Bring them
anymore.
out here to enjoy some gelato.
Oh, I don't.
Good thing to do today.
Yeah, I don't want kids enjoying anything. They should shut up, be seen and not heard until they're 18.
I'm going to pull right out and introduce you to our guest, he's been with us before, both on the podcast and. Have you done the television show, Brad?
I did the Pelican broadcast.
Yeah, that's it. So you've done the radio show, the TV show, the podcast. Yep. So you're broken in.
You're
Brad Harris.
Your
EMS,
career is
East
over.
Baton
You
Rouge
have
Parish.
peaked.
This is it.
This is it.
Glad to have you with us once again. We just realized it had been a long time since I think maybe March or April was the last time we had a chat with EMS.
Yeah, I think the last time I was here, we spoke about COVID, and it was just kind of coming out at the time, and we had started our, I guess what we call them, our pandemic response units. That's when we had our ambulances that we converted into the actual COVID trucks. Once the lockdown kind of went away and things kind of started getting back to normal, we got rid of the trucks. We don't have them anymore. However, they are capable of being, put back into their.
God forbid that should be necessary, though.
Yeah, hopefully not. We really want to thank the Baton Rouge Fire Department. They helped us out with that. They supplied some manpower for those COVID trucks, and they assisted us on all the calls and whatnot. But really, we're able to put up another truck now. We have an extra truck that's riding around just to keep up with the call volume. The call volume in general has gone up since the lockdown ended. More people are out and about now, more car accidents, that sort of thing, and then just going to their doctor's appointments and stuff like that. So.
The mortality rate, as opposed to the rates of infection, seems to be dropping.
Yes.
And I'm guessing if you retired the COVID trucks, that means less people are needing hospitalization when they get this virus. Is that pretty much the way it is, or?
Yeah, from what I'm seeing is we are still seeing some COVID positive patients. They'll call 911 and they'll tell us over the phone, like, I have been tested, I am positive. So we know ahead of time that they need to put the respirator masks on, but we do that anyway with every call. We're not doing too much, out of the ordinary for these particular patients. We're just treating them like any other patient that we would.
Let me ask you this. Someone was talking to me a couple weeks ago, and they were saying, we're seeing news reports from all over the country, and we know you all are very close, meaning Kevin and I, with our broadcast to first responders. And they said, nobody bothers to ask how first responders are doing in terms of what have you learned about your men and women, if they've been exposed, if some of them have gotten, same thing with FD and PD.
Yeah.
On the national news for the first time Tuesday night, one of the big units in the Texas Medical Center in Houston reported 24 of their nurses had tested positive. So how have you all fared during all this?
We've done really well. I think I could have this number wrong, but I know personally of 2 people that have gotten it. That work for our department, and both of them are fine.
That's a very small number.
Yeah, out of 200 employees, we only had 2 that I know of. There might be 1 or 2 more that I don't know about, but everybody's doing good. We're just practicing social distancing. We're wearing our respirator masks on every call. We're more hyper vigilant now of washing your hands and that sort of thing, and stuff that we were already doing before this crisis, but it just makes you more cognizant of it now.
Now we are hitting the hottest days of the year so far.
Yes.
National Weather Service has classified the heat index for today, tomorrow, and Sunday as to be extremely dangerous.
Yep.
I imagine your heat-related calls are jumping through the roof.
We're getting them already. The last couple of days I've heard them go out. I know yesterday we had one I heard. I'll talk about heat-related emergencies. So, there's 3 stages of a heat-related emergency. Normally you start with the heat cramps. That's where your muscles kind of start contracting and that sort of thing. And it's really easy just to get in a cooler environment, drink some fluids, that sort of thing, and that'll kind of, it'll cure itself over time. But then you get into heat exhaustion, and then you progress to heat stroke, which is a true emergency. People can die from a heat stroke, and that's when your body is unable to adjust to the temperature. You stop sweating, you're unable to keep your fluids and that sort of thing. So you probably need like IV access and possible hospitalization for that. You can go into a coma, you can have seizures, that sort of thing. So you definitely need to make sure that you stay hydrated and you stay in a cool environment in the shade and that sort of thing the next few days for sure.
If someone has gotten to the point of heat stroke and 911 is called and you go out there, can you start the cooling process en route?
Yeah, well, we do it en route, but also too, the 911 operator will kind of assist the caller over the phone. They'll tell them, get them in a cool environment, get some cold towels on them if you can, if you have some water, that sort of thing. You want to rapidly cool this person down as quickly as possible. But en route, yeah, we have cold packs we could put on them. All of our units have air conditioners, obviously. So we would start that process before they got to the hospital.
Stand them up in a cold shower, put them in the tub. What else?
Whatever you can do. You want to get cold packs underneath their armpits and their groin areas, that sort of thing. You just want to monitor them if they start to have a seizure.
Help me out. Why those areas?
Well, the blood supply is closer to the skin surface there,
Okay.
so it gets the body colder
All
faster.
right, femoral artery down there in the
Yeah,
groin.
your femoral artery, your brachial artery is up here, and so that's the best thing that you could do. And then just monitor the patient if they start to have a seizure. Make sure that they don't injure themselves, they don't hit their head on anything if they fall, that sort of thing. And just make sure they continue to breathe. You might have to hold their airway open if they're unconscious, that sort of thing.
People have a tendency to get a little bit disoriented too when they're going
Yes.
into heat stroke. They may
Right.
not realize they're in trouble.
They might not realize they're in trouble. They also might not realize that you're trying to help them. You'll see people that might become a little combative. They don't know what's going on with their bodies. They're out of it. They're disoriented. So they might try to fight you off. They think that you're trying to hold them down or something, and they try to kind of fight with you. So just keep yourself safe as well.
Underlying problems that can make a heat stroke incident worse or heat exhaust. Is diabetes one of those? Does that make it worse if you're diabetic?
Diabetics, obesity, alcoholism, just elderly people in general are unable to maintain their temperature.
And again, one of the first things you said, and we've heard this all of our lives, we've been paying attention, is fluids. Now, a lot of people today think they're being very smart, reaching for the Gatorade and the Powerade, but
Right.
really you want to start with water, don't you?
Yeah, you start with water. Now, the Gatorades and Powerades are good because they have electrolytes and sugars. However, it can also upset your stomach. Your stomach starts to cramp. It might cause you to vomit. So you just want to get water down. If it comes to the point where you cannot physically take in enough water to stay hydrated, that's when you need IV access.
I want to ask you a question about water, because I've heard things, wives' tales and things like that. And in heat, I don't want to say stroke's a strong one, but when someone's suffering from heat stress, is it better to have that water iced down, or is it better to start them out on room temp?
I'd say start them on room temperature water. If it's too cold, it can kind of cause those contractions even more.
So that's what that was the wives' tale I was told. Don't hit them with ice water, because that will
Yeah.
just shock their system.
Right. The heat stroke, really, you kind of want to do passive cooling for these people initially. If they become unresponsive or their body heat is just at such an elevated temperature, you're going to want to rapidly cool them. But for the most part, if the person is still conscious, they're still able to drink fluids, just get them in the shade, get them in the air conditioner, that sort of thing. You wouldn't do the ice packs and things like I was talking about before unless it's an extreme temperature.
In addition, I think, to just pure heat exposure, I would think, now that everybody is out a little more,
Yep.
and I'm thinking you're probably also seeing some allergic reactions to insect bites or stings.
Yeah, yeah.
And probably some people burning themselves on the old backyard grill. Are
That
you getting a
happens.
lot of that?
We had some fireworks injuries over the last weekend.
Please
Yeah.
tell us,
Yeah.
please.
No, I can't go into detail, but
Anybody lose
you
a
just
finger?
gotta be careful. So yeah, it's
Mostly burns, or
yeah, just burns.
one of the worst burns I ever got was on the fuse of a mortar shell.
Oh,
Yeah.
oh.
And I mean,
imagine.
it burned me bad. I mean, I was 9 weeks.
What's that,
healing
about
from that burn.
6,000 degrees?
Oh,
one
it's
of those
it's
fuses?
unbelievable.
Yeah.
You know, and people play around with them, and then they start drinking alcohol, and then, you know, they use poor judgment. But I've personally been on a few of these fireworks injuries over the years, and they can be pretty gruesome.
So how does one treat a burn, and when do they know that the burn is severe enough that they need to call you?
Yeah. So there's 3 stages, or sometimes they say 4 stages of a burn: first degree, second, third, sometimes a fourth. First degree burn is like a sunburn. You know, your skin gets really red, it's get hot, it burns. Those you can use like an aloe vera gel. You can put some kind of a cooling cream on it, that sort of thing. That's not something you would need to call an ambulance for. Second degree is when the skin starts to blister. And then third degree is when you actually get down past the dermis and you kind of get some muscle involved in it.
Very deep burn.
Very deep burn, it turns black. That's when you definitely need to call an ambulance and get to the hospital.
Now, a lot of it also depends on where.
Yes.
If you've got like second degree on your face, I would think you would worry about airway involvement. You're going to want to
Airway.
call EMS.
Because what happens is when you get a second degree burn, the fluid shifts in your body. So instead of being in the vasculature, it goes into what they call the third spacing. So your skin starts to swell. So if you get something on your face, it can obviously swell in your throat, in your neck. If there's smoke involved with this, you can inhale that smoke, and then that can also cause you know, the inside of your lungs and whatnot to be affected as well. So, you know, if you have a second degree burn on your foot, not a big deal. Second degree burn around your mouth and nose, that could be potential.
And again, this is, if it's the minor burn, if you're not paying attention, you put the back of your hand up against the grill while you're trying to flip something.
Yeah.
That's where you want your ice water real quick.
Yeah, put in some
Dump
ice
that
water.
hand in there.
Absolutely.
Brad, this is something you probably have to talk around, not about, if you know, and you see what I'm talking about. You guys have been really busy with GSW lately, gunshot
Yeah, we
wounds.
have.
What can you tell us about gunshot wounds, and things, gunshot responses?
Yeah, if you you know, if you encounter a victim that has been shot, you know, it depends on where the entry wound is and the exit wound, but the main thing you want to do is stop the bleed. That's the number one thing that people die from normally, is the blood loss. So you're going to want to get some clean, if possible, clean dressings to put over the wound, hold pressure on it, you know, wait for the ambulance to get there. Again, you're going to want to watch their airway, make sure they're breathing appropriately and that sort of thing. If it's, that's pretty much it. Just try to stop the bleed mostly.
As I was trained with some first aid techniques, and I've never dealt with a gunshot wound. If the wound is through and through, do you have to give equal care to both
Oh, absolutely.
entry and exit?
Yeah, it's the same as, you know, you put the dressing on the entry wound, and if there's an exit wound, you put it on the opposite side as well. Just hold pressure on it, and hopefully that'll kind of control the bleed.
So as someone trying to practice first aid, you've got to first look and see if there's an exit wound, right?
Yeah, definitely check for an exit wound. I mean, even professionals, you know, sometimes you'll have someone that might be shot multiple times, and you might miss one. You know, you're so focused on one injury that you might not notice that they have a second or a third injury underneath their clothing. So we always have to make sure that their body's exposed, that we can see everything. You know, if there's an entrance wound in the chest, you always want to look in the back just to make sure. And bullets it depends on the caliber of the bullet, what it hits inside the body. You know, like if you have like a little 22 bullet, it might bounce around. It might come in, you know, right here, but it'll hit a bone and it'll go down. So you might find the bullet in their leg or something. It's kind of wild, actually. I've seen patients that, you know, they have an entry wound somewhere, and then they do the x-rays at the hospital, and the bullet's nowhere near the entry wound.
Oh, yeah.
So, yeah, it's just something you have to look out for.
Let me ask your professional opinion.
Okay.
There is a trauma surgeon in Baltimore, and this guy is a legit guy. And for about the past year and a half, he has a video out, and he is asking people to help save lives by getting, and he's not selling it, but getting a gunshot wound first aid kit. And he instructs people on basically packing the wound,
Right.
on using tourniquets, on using quick clot,
Yeah.
things like that. And there are people that are actually buying these. I know that a lot of police departments now are having their cops equipped with those until you guys get there, because they're usually first. How do you feel about that? I mean, as someone that has to be on the top of your game when you make a response, could somebody going that deep actually make it harder for you to do your job, or is it basically not a bad idea?
I don't think it's a bad idea personally. We don't use quick clot, or we also don't pack a wound either. We just use direct pressure over the wound. You know, if I arrive on a scene and someone has used that product, I'll just keep it on it. And, you know, when they get to the hospital, they'll manage it.
So you are seeing it, though?
Personally, I have not, but I can see where that would happen. They have, when the active shooters were kind of popular, you know, a couple of years ago, we went through several active shooter drills, and they have what's called an active shooter kit that people were trying to sell to schools. And it was the same thing. It's like a little duffel bag. It's got, you know, 10 tourniquets, you know, a bunch of things like that. A tourniquet is not a bad idea at all, but you have to know how to apply the tourniquet. That's the problem. Someone might put it on incorrectly, which, you know, if we get there and it's incorrectly put on, we'll just take it off and we'll put our own on there. Putting a tourniquet on, depending on where the wound is, you have to use it only on an extremity. So if someone gets shot, you know, down here in their arm, you want to put the tourniquet as high up as you can. Same reason for the ice packs. You have your arteries right there, so you're going to put a tourniquet way up here. Same thing with the leg. You're going to put it way up high. And what that's going to do is constrict the blood vessels to where the person won't bleed as much, or if at all. And you want to make sure that they lose a pulse in their arm. Because if you put it on incorrectly and they still have blood flow, it can cause the arm to trap blood in there.
Now, see, this is something nobody has ever said. You know, unless they're, you know, trained like you,
Right.
or, you know, a physician or a nurse, nobody's ever said, if you put that tourniquet on, check for a pulse.
Right.
And if you put it on the leg, check in the middle of the foot to see if there's a pedal pulse.
Yeah.
Nobody ever tells people that.
Yeah.
That's how you know if you got it on right.
And, you know, it's painful. So if you put a tourniquet on someone and they start telling you, oh my gosh, it hurts so bad, most people's instincts are, oh, I don't want to hurt them. I'm going to loosen it. You don't want to loosen it. That's defeating the purpose of it.
I know it hurts, but you want to bleed out.
Exactly. I'm trying to save your life.
Jane contributes this to the, she says feminine hygiene products work well.
Oh,
to
yeah.
Staunch bleeding and sometimes pack it off.
All right.
Have you ever seen anybody use those on the spot?
I have not, but I can see that. I can see that happening.
Yeah,
Anything's possible.
Yeah, I mean, there are a lot of, back in the day, there were a lot of ERs and ambulances that always had a
carried 'em.
supply of tampons.
I was gonna ask the question. Is it like napkins, tampons, or both?
The tampon will actually
stick
fit
it right in the wound.
in a bullet hole
Stick it in
or a knife
there,
wound.
and it absorbs a lot. So.
Yeah, and it expands when it gets in there.
Another, I'm getting away from gunshot wounds, but while you're waiting for EMS, if you've got to staunch a wound and try to stop bleeding, are there preferred materials? Should you use paper products? Should you use linens, towels?
Yeah.
What
You
would
wanna-
be better household product?
I definitely say cloth material. If you use paper, it's going to stick. It might tear, and you have little pieces of paper inside the wound. So clean the wound if you can. You know, just wrap it in some kind of a cloth material, a washcloth, hand towel, a T-shirt, anything you have available.
If you're going out with the family, and you're going to go somewhere, and you might be doing a little hiking,
Right.
where there's insects, or somebody might slip on a rock and bump their arm and cut it, or old Uncle Frank might all of a sudden start feeling a little wheezy, what's in your first aid kit that you take?
So bandaging supplies is the first thing you want to have. Just some, they sell, you can go to the pharmacy and buy like little first aid kits, and normally they'll have like what they call a 4x4 gauze. That's just 4 inches by 4 inches gauze. So you'll have some of those in there, Band-Aids. They have a thing called a triangle bandage, but you can make one of those yourself. That's for a sling if you break your arm. I would have some Benadryl in there. They have the Benadryl cream. They have insect sting relief cream. You talked about the heart problems. You can definitely carry some aspirin in there. Antacids, hydrogen peroxide, that sort of thing. So,
Some people differ on whether or not you should put an antiseptic on a wound immediately, like a Neosporin
Right.
or something
Yeah.
like that.
we carry the antibiotic ointment on the ambulance, and we put them on. So, you want to make sure there's no infection in the wound. So,
No ace bandage in your personal first aid kit?
I don't even have one, to be honest with you. I don't have
Really?
a first. I don't. But if I did, an ace bandage, it's not if you sprain your ankle or something like that, they can definitely help. Another thing I was just thinking about was glucose tablets as well. That's
Yeah.
another thing that you could have for a diabetic patient.
I hope you all are writing this down or listening very carefully, or we'll go to the replay and hear it all over again.
Take notes.
They sell commercial first aid kits that have all that already. If you want to piecemeal one together, more than welcome to. Just over-the-counter products.
Well, one of the things that we have all, I guess, embraced, some more than others, is that we have to be kind of responsible for our own personal care for at least 5 or 6 minutes until you guys get there. And I thought it was wonderful when AEDs started to come into play, and you'd see them in large office buildings and in schools and things like that.
Yes.
Are you all seeing a lot of use of AEDs?
We do actually.
Okay, I'm sorry, AEDs.
Oh, the
help me.
automatic external defibrillator.
Okay,
The thing that's
thank
hanging
you.
on the wall.
Just, some of us are
And
uneducated.
it's dummy-proof. It reads you the instructions.
Okay,
Yeah.
thank you.
So those are they can definitely save someone's life. You still see them at the malls. You still see them at shopping centers, at movie theaters, that sort of thing. EMS actually has what's called an AED registry. If you go to the EMS website, you can come in. We have some customers coming in.
Welcome, come on in.
Hi.
I won't breathe on you.
The AEDs, I lost my train. So anyway, the registry, you can go on there and you can register your AED. It's actually an ordinance in East Baton Rouge Parish. You're supposed to register your AED if you have one. And then if you go on the registry and you register it, it'll keep you updated with any kind of updates to your monitor. It'll tell you when your pads are about to expire, that sort of thing. It kind of keeps track of it. Sometimes the 911 operator will ask, is there an AED available? And that's good information to know. So the AEDs are really good. They are dummy proof, just like you said. As soon as you open it up, it talks to you. It'll say, open the package, place the electrodes here and there. It tells you exactly how to do it. It'll say push this button. So anybody can pick one up and
And it won't
save
let
a
you
life.
shock if there's a heart rhythm. You can't make a mistake.
Cannot make a mistake. It will physically not allow you to push the button and shock them. If you could push it all day and it won't actually shock unless there's no heartbeat.
It would be like, Kevin, get your hands off the button. Do not shock Bill. I know you want to.
I
Get your
really
hands
want
off the
to.
button.
But so we actually carry heart monitors as well in the ambulance, but ours are manual, so we could shock somebody if we, even if they didn't need it. But we're all trained how to use those. So.
I like in like cop movies and stuff, when the guy uses a defibrillator as a defensive weapon.
Yeah.
What would that actually do to a person that?
It could stop their heart.
It's not good. I actually got accidentally defibrillated once when I was working at the hospital. We had a visitor to
Hey, live to tell the tale.
We had a visitor to someone that was actually in an ER bed, and they were going to be fine. And the visitor, boom, hits the ground at the foot of the bed on the tile floor. And it's like, no pulse, no breathing. So everybody there starts to work on this guy.
Yeah.
And we had a student nurse who had been around maybe about 5 or 6 months. And she brings over the defibrillator. And old Bill is up at the head end with the ambu bag squeezing. All right? And she doesn't yell clear. She just slaps the paddles on him and says, no rhythm, and goes, bam! And thank God Bill was wearing what we used to call conductive shoes and had that rubber ambu bag in his hand, because it lessened the jolt that passed through this person into me.
Yep.
It worked, by the way. She brought him back. She damn near killed me.
It can happen.
Yeah.
Definitely want to make sure nobody's touching the patient at all whenever you hit the button. So
I'm trying to think if there, before we let you go, if there are any other common summertime injuries we could talk about treating or avoiding.
Children in general, you have the kids that fall off their bicycles and that sort of thing. Swimming danger, drowning, that's a major one.
Don't turn your back on those kids.
Make sure that they have floats available in the pool. They have access to them. Make sure someone's always watching them. Use the buddy system. Kids, don't go swim by yourself. Let an adult know what you're doing before you go.
Resuscitation for a drowning victim? Same as
Okay.
CPR, basically?
Yeah, it's CPR. If they have water in their lungs or their airway, you can kind of put them on their side and hit their back and see if you can get some of the water out first. But basically just open their airway, make sure that, if they are not breathing, just, you do your regular resuscitation on them.
Well, and I think we're dancing around the acute ethanol overdose that happens a lot in the summertime.
Yeah, so with alcohol ingestion, basically, you want to make sure that they're maintaining their airway. Don't give them anything by mouth if you can, because they have a propensity to vomit. Just make sure they don't injure themselves. If they're unresponsive, just make sure they continue to breathe. Just make sure you continue to watch them as well. Don't just put them in a bed and shut the door and walk away.
And is it true that it is a little bit more dangerous to drink when you're out in the heat? That the effects of both the alcohol and the heat are magnified by the combination?
Yeah, and the alcohol causes dehydration in the body as well. So you also have to make sure that you drink lots of water with your alcohol if you're going to be doing it. So.
Lieutenant Brad Harris with EMS. So glad to have you with us today, and we look forward to visiting with you and some of the other folks again very, very soon.
Absolutely. We'll have to do it, and I enjoy coming to this location. It smells fantastic in here.
Oh, yeah. Still the best breakfast in Baton Rouge. We're going to take our break, folks, which means it's time for you to get another cup of coffee or hop in the car and come on over and join us in person. And we'll be back with you on the Morning Exiles Facebook Live broadcast in about 5 minutes. Stick around. The iPhone 11 would have to use its microphones rather than